and I just wanted to read it because I think it would be very interesting to explore. She talks about being avoidant working with trauma because all the CPDs I've done on trauma say you need to be well trained in trauma, but I couldn't find the training beyond a couple of hours. And I think it's very often the case, you know, you attend seminars, couple of hours, well, hours will be 2 days, so that's already not a couple of hours. And we run certificate in trauma treatments, which is 8 days. But at what point you can feel I've had enough training, I can go into that field, and what kind of safety nets you need to feel confident to work in the field, Andrew?
Yeah, it's a really good question. I think you need to start with a clear model. And I think it's very easy in trauma work to pull in lots of different techniques from different approaches and take a kind of eclectic view, because people's suffering, it tends to be quite broad and in many areas. And so I think the tendency is to sort of try something from this tradition, something from that, something from another one, and try and kind of pull something together that treats those individual symptoms as though they were isolated things. I think one of the things that will really help people is having a cohesive model of treating the causal mechanisms. And that's really what this couple of days is based on. It's built on the most widely used model of treating PTSD, which is the Ehlers and Clark model, but then adds to that core treatment approach the specific things that are useful where there's a kind of emotional and sexually traumatic component. But I think it's that confidence in your core model, and if you work to that core model, chances are you'll give people a good therapeutic experience and the best possible chance of recovery. But because people's chances of recovery are close to zero if they don't get an evidence-based clear model. So I think for me it's the importance of having a very, very clear model and working to that. But it is a really good point I think Sue makes about that confidence to do that work, because you're right, you often hear this kind of only the most experienced therapists can do that, and only if you've kind of really highly trained, highly specialized. But I don't think that's the case. I think you need a good enough level of training and a good enough model to genuinely make a difference, and you'll see that therapeutically if you just work with that clarity and stick to the simple principles, work to those, understand why you're using those, have a clear kind of rationale. That's what will positively make a difference.
Mm. Yeah, I mean, if I could just say something about that as well, I think very often people, in a sense, merge two separate things when they're thinking about working with trauma. They merge, in a way, the sort of anxiety and other negative emotions that they understandably feel with regards to the material itself, the actual narrative material, combined with not having a clear model about how to proceed, which also makes them feel anxious. And actually, I think you make a really important point that having a clear approach, which incidentally draws on to at least some degree other generic skills that the person will have been trained in and they can bring to bear, makes at least that particular bit, when you get some guidance about how to actually use it, less scary. But that's a separate thing from the scariness of the material, which, as you've highlighted already, needs to be addressed in a different forum. But I think very often people end up combining or confusing the two, really, and that sort of compounds the worry and the avoidance, which you've already mentioned. Yeah,
that's a really good point, Paul. I think it's tough material to move towards, and you have to be confident that you're going to be okay and the patient's going to be okay as a result of that moving towards. and hopefully people will feel that confidence after a couple of days of us thinking about it together, and looking at your concerns and the skills people are worried about not having, and then practicing those and trying them out together. And you're right, Paul, that idea that as a kind of community of therapists, many of those skills you have as a therapist from treating other kinds of problems will be brought in and useful, and they'll be part of the treatment package, but with some key additions, without which improvement's unlikely.
Yeah.
I wanted to also read a comment from Florence, which again expands on what you're saying. And she says the combination of the trauma and sex as taboo subjects, along with the fragmentation of services, has led to significantly high but invisible and unmet needs of for young people, women and men. So it sort of makes the problem worse in a way, because we hesitate, because I think what you are suggesting, Andrew, in terms of having a clear model and following it and being confident in that model. What about, for example, supervision, follow-up trainings, some sort of network with other therapists? Can that help in terms of gaining confidence in this work?
Yeah, that's a really good question. And I think particularly, I know many of the therapists that I've gotten to know through your training programs are people who work in isolation. And for one reason or another, whether that's because they're sole therapist employed in a particular organization like a school, or because they're in independent practice, or just geographically. And I do think that drawing on your community of therapists is really helpful to sustain you in the work. Particularly if you're working in isolation. I think ensuring that you have a supervisor who's confident in treating post-traumatic stress is really important to help you not just keep to the model, but to also reflect with you about what impact it's having on you when you keep to the model, and what it's like for you as a therapist to be doing that work. I think your ability to reflect on that is enhanced by a good supervisor. And in terms of sort of follow-up CPD, and I think there probably is something useful about being able to sit with your fellow therapists at some point in some forum and talk about what that work's been like, and to share good practice, and also share times when you're stuck as well.
Okay, I mean, can I, sorry, did you want to?
Yeah, I just wanted to say that what we're trying to address this need, because apart from running 8 days trauma treatments certificate, BPS approved, and all these courses, we've done what we call trauma season this year, because we had trauma-informed practice, compassion focused approach to trauma, now your course on emotional and sexual trauma. And we also carry on, once you've attended one of the trauma courses, we try to also arrange tutorials which are free for those who attended trauma courses. And Andrew is going to be doing a tutorial for us very soon. I think it's in November, and you will be able to attend it after attending this course. So I think it is very important to, especially if you work in isolation, to carry on just checking, making sure that you are still seeing other therapists who work in the field, seeing tutors, and just making sure that you are still there, you know, with the latest information.